Hello everyone. So this video is for the people who they might have been caught in the very strange position of being told that they need an MRI scan or that they need some blood test or an ultrasound, any type of further investigations basically. And either they were told, but now you have to wait until you're able to go and have them, or in some cases, it might have been that they were already scheduled for them and now they're cancelled. And I can only imagine how anxiety evoking it can be to know that you were told you need an investigation, that you were scheduled for one, and now you are just waiting. And what does that mean for you? Does it mean that you shouldn't be moving? Does it mean that you might collapse at any time? So it is for us to examine those things. Now, before I go any further, I'll make the usual disclaimers that are also in my introduction and so on. So I'll just turn a little bit the camera here. And there are about the limitations of what I can discuss. The main limitation is I cannot really give you clinical advice because obviously you are not somebody I've been working with for your health. I don't know your previous medical history. I don't even know if anyone is watching this, in all honesty, but if somebody is, I don't know whom this person is. I haven't examined them. Obviously, you need to trust what your doctors, physiotherapists, occupational therapists, nurses, whom you're seeing has told you. And if in doubt, always do contact them. You can obviously always ask me questions that are more personal to you, either in the comments below, or obviously if you don't want your question to be public and viewed by everyone, you can liaise with me either on a personal message or via email. Or if you know somebody who knows me, you can tell them and communicate with me via that way. So one thing that we need to clarify is this: at this time of the quarantine, obviously you would still not let people suffer something extremely dangerous and detrimental to their life, whether it is the extreme like loss of life, or it is something that might lead to that, or to extremely severe disability. Or this severe disability doesn't have to be extremely severe. So, for examples would include, suspicion of cancers, or things like fractures, which, they're not life-threatening, but if it doesn't heal properly, obviously, you wouldn't let it, you wouldn't let it untreated. So anything that was urgent is still urgent, and that you can still see people for. And don't suffer in silence. If you think no one can see me this time period, and this is why you haven't contacted your GP, or for instance in the UK it's the number 111 that we can call and discuss our health, I would really urge you to do so if you suspect that you have something new, something that troubles you, and they can offer you advice. Now, if you were scheduled for an MRI scan and it was felt that this is an urgent MRI scan for the reasons already discussed, I would like to reassure you that that would still happen. Because as we discussed already, you won't let somebody gravely suffer. The MRI scans that might not happen, and that not only MRI scans, blood tests, whatever have you, is for things that, we still want to know, and once this is over, you're going to have those examinations as normal, and they affect your treatment. But while you wait, it won't really change your health. It's just very anxious place to be. And also for some people, if, for instance, in the examples that I can think of that have to do with long-term pain management, sometimes people were waiting for an MRI scan to advise if an injection would be helpful to them, or even surgery. And obviously they were really hopeful that that might give them some respite from their pain. And it causes a delay. So it causes suffering in that sense of a delay, but it shouldn't cause suffering in the overall outcome of your health. And that is what relates mainly with a quarantine. Just to summarize, if it is something urgent, it will still happen. If they have rescheduled, it doesn't mean that it's not needed, but it's not needed in the urgent sense. It just prolongs the waiting period, which obviously is not the greatest, but it is not to gravely worry you either. In general, let's also think, when do we need certain investigations, and that perhaps also relates to things other than the quarantine. And there is questions that I haven't just been asked now, I have even been asked before, but I suppose now it's harder because we don't have as many people to see and discuss things with. So MRI scans is an investigation that people want a lot, regardless what the problem is, because it is thought as the best investigation, the king of investigations, the one that will demystify everything. And it is true that it is a very good photograph, internal photograph of our body. This is basically what it is. I'm simplifying, but yeah, that's the gist of it. As good as an MRI scan is, it's not the best or relevant investigation for any type of condition. It doesn't necessarily give us information for certain things. For certain things, it might be that an ultrasound is a better investigation. It really depends on what it is that we want to see. Sometimes a simple X-ray might be a far better investigation. For instance, for some type of fractures, an X-ray would actually make a better initial investigation. So there are many reasons why an MRI scan might not be what is advised to you, and it might be a different type of investigation, or no investigations at all. People seem to think that if they had investigations for something, that those will be repeated every few years. And we have that impression for very good reasons, not because we are unreasonable people that want to be the center of attention, or there is something strange with us that we love to have investigations done. That's not at all true. But that impression, I think, is created by the fact that for certain conditions that is true. It is what we call monitoring. The conditions that we will do this monitoring is conditions that things can change every so often. A good example would be thyroid conditions. You will need to, or for instance, things like diabetes, you need to monitor where things are. There used to be this idea that we need to MRI scan people's spines every 2 years if they had a problem. And for certain cases that might still be true, but you would have been made aware by it, by your GP. There would be a plan in place for you. In the vast majority of cases, that is untrue. We have come to realize that an MRI scan is needed only if your symptoms change. And not change in the sense that they feel a bit worse, but change in terms of becoming different, being dramatically worse. So there needs to be a distinct difference. And you might not always be in a great position to evaluate yourself what a distinct difference is, because it's your own health. It causes a different worry. I'm so more relaxed about other people's health. When it comes to my own health, the relaxation stops, So when it is our own health, it is more worrying. And for that reason, we might be more stressed about whether we should have more investigations. And many times when I discuss it with people, like, why would you think that you need something? Very commonly, the reply is, so I know. And on occasion, actually, we might issue investigations just for that reason, for reassurance for the person who has whatever symptoms. And we have explained to them that, listen, we just think, for instance, that you have, facet joint arthritis. and then they have an MRI scan, and it actually shows what we said to them, because clinical examination many times might not be even touching the patient, it's just the things that they tell you is enough to give us the information of what is going on. And it can act in a reassuring way. My experience, though, is that it's not always reassuring if the symptoms persist, because the idea enters in our minds: what if it is something different? What if something is being missed? And people lose their reassurance and again want another investigation and another investigation, and that might become endless. And one might think, so what's the harm of keep on giving investigations? Investigations are not innocent. Some are harmful themselves, or they're massively expensive, and also, even if they're not harmful, they might be very scary investigations. But there is this added thing. With investigations, it's very likely that we will see something, because nobody's body is perfect. It doesn't mean it's unhealthy, but we might see something. And this is why many times I have opted out for investigations for myself, even ones that the doctor might have insisted, but because I was confident that it was something that I understood quite well, because it was musculoskeletal. And I realized that, you know what, let's wait on it, because once you know. And even though you might not be reassured that this is not actually something dangerous, it doesn't put you in more danger. If you have been told something like you have knee arthritis, or your meniscus is gone, and you also have pain, it's only human that you will keep returning to that, and you will feel there's something quite unsafe with your knee, and might even lead you to adopt behaviors that, other than helping the health of your knee, lead to a different behavior that causes harm in itself. Therefore, we would prefer, when we work with people, that once either they had the investigations that they needed and we can reassure them, and then they are not reassured, to work more towards, but how can you now be reassured? Otherwise it becomes a vicious circle. Or in case that you might have had no investigation ever whatsoever, and you might think yourself that you need one, obviously you always have the option to go privately if you're so convinced that you need one. But be aware that many times when we persevere with things, and I've seen many times people traveling in other countries, getting their investigation in places that they have a very medicalized approach, and they end up having unnecessary surgeries or injections, and that is more detrimental to their health. What I would advise overall in general is, if you have a good relationship with your GP, with your physiotherapist, with the person that you're seeing, discuss your concerns with them. That is personal to you. And if you feel that trust is missing, always seek a second opinion. I don't advise to go what we call doctor shopping. Think of Michael Jackson. If you ask enough people, there will always be someone prepared to do the thing or say the thing that feels that it meets with your own thoughts, but actually might be quite harmful. So if you seek a second opinion, don't seek for somebody who will validate your own thoughts. I'm not saying that your thoughts might not be correct or might not be actually validated, but don't go with whom is likely to validate your thoughts. Go with a person that you have done your own research and they're very, very good at their work and you fully trust them. And that would be my advice around that. But in the meantime, if you're waiting for investigation that has been rescheduled, please be reassured for anything urgent that would have gone ahead as normal. Other things will go ahead when the time is, and I'm really feeling for you having to wait through that time period. And if you are someone who thinks that perhaps they needed an investigation and they haven't had it, the first thing I will say is, have you been in contact with someone about the thing that you think you need the investigation for? If you haven't, that's the first thing to do, and they can evaluate whether you need one, whether you need one urgently or in future time. Or if you haven't, they have told you, no, it's okay, except if your symptoms change in an unmistakable way, in which case you need to contact them again. I'm not saying still that you will need then an investigation, but you need to contact them again. I will say in all probability you're quite safe to be as you are, and just look after yourself, your health, your well-being. Remember, always there is no separation in our body between what we say soul or brain or whatever and the physical tissues. It's all one, they're all connected, they interact with each other. So take good care of yourself, spirit and body, and especially during isolation, it can be a little bit more challenging. Take care. Bye bye.